Awatira te taira, e pare ana te tai ki hea, e pare ana te tai ki te kauheke kaumātua, hea tua. O tēnā ngā reo ngā kārangatanga maha koutou o te kāinga, John, tēnā koutou te reo pōhiri, te reo karanga, a kua tae mai te katoa, ki te ata tiro ngā tini take e pāna ki a tātou. Thank you for the introduction. A little bit longer than necessary, but thank you for it. So I'm going to talk a bit about health. Just want to clarify, when I talk about health, I'm not talking about sickness. Sometimes that word gets confused. When we say health, we talk about sickness. Health services are sickness services. I want to talk about health. If we're going to go anywhere into the future, we need to put health first, not start with sickness. Now, I've forgotten what I was going to talk about. What I do want to emphasise is that we can't just blindly walk into the future. There is a past that really constructs the future. And if we get to know what's been important in the past, we know what to build on as we move into the future. So I'm actually much better at looking into the past, and I'm a little bit scared about looking into the future. But the past is, to some extent, captured in 5 decades that I thought we might look at. Go back to 1970. Some of you won't remember 1970 because you weren't born. Others you will have forgotten it because you can't remember. But to look at decade 1, which was 1970 to 1979, decade 2 up to 1980 to 89, decade 3, 1990 to 1999, 2000 to 2009, and the decade that we've just left a year or two ago, 2010 to 2019. So what I want to talk about are some of the events that helped shape where we are today that happened in those decades. I'm talking about events that sort of have some personal connection to me, or things that I know about, but there'll be many, many other events that I won't be talking about that have helped shape where we are today and will shape our path into tomorrow. So before I do that, I just want to do a quick step back into the 1960s. When I was at medical school in the 1960s, these were medical students whom I knew and who became doctors and were part and parcel of the journey that I've been on. Unfortunately, all of these have passed on, but I remember them as colleagues and the important contributions that all of them made to where we are today. So decade 1 then, 1970. That's the year I came back from study in Canada, in Montreal, to take a position as a psychiatrist in Manawaroa. Manawaroa was a psychiatric unit, had just been opened they opened it the week before I got back, as a community mental health facility. There were 2 of them in the country at the same time, had been built, one at Palmerston North, one at Invercargill, and the idea was that these facilities would be more linked to the community than they were previously when mental hospitals used to be the only source of support. In 1972, there was an act passed which shut down mental hospitals and transferred the responsibilities for mental health to hospital boards and later on to district hospital boards. So some of you will remember those hospitals. The last one to close down was Lake Alice, which didn't close down until 1999, and that was because it had the maximum security unit within it, and they had a hard job knowing what to do with that. But these were huge hospitals. They had opened in the 1860s. Some of them had 2,000 patients. Smaller ones had 800 patients, but they were all major institutions, and that was the centre for mental health in those days. So in 1970 then, that began to change. Other really important things happened in 1970 as well. 1972, a group of Māori students at Auckland University formed Ngā Tamatoa. They took a march, a petition to Wellington to say that Te Reo Māori should be part and parcel of our education and of all our programs in the country. 1975, Dame Whina Cooper led a land march from far north down to Parliament under the catch cry, "Not 1 acre more," and that was a petition which said that Māori land should be owned by Māori. And here comes my gin. Oh, thank you. No, very good. So Whina Cooper's march then in 1975, joined by thousands of others who all came down to protest the way that Māori land was being alienated and the need for Māori land to stay with Māori. 2 years after that, the Waitangi Tribunal was formed, partly as a response to the land march, but partly also because of the numerous complaints that had been made to government without any way of solving them, and it was Matt Rata who introduced the notion for and supported the passage of the Waitangi Tribunal Act. 1977, Bastion Point, where Ngāti Whātua, then joined by hundreds of others from all around the country, took possession of their land, which Muldoon was about to sell off to build high-rise homes. That didn't happen. It didn't happen because of Bastion Point and the fight that those people put to protect their own land. In 1978, the Raglan Golf Course occupation occurred. A similar effort. The golf course had been built on land which had never been formally sold to them. It had been alienated from the people there. So in decade one, some big changes going on, mental health changing, a big emphasis on Te Reo Māori, big emphasis on land. Land as being a fairly critical component of health. Moving on then to decade two, between 1980 and 1989. 1981, the first Kohanga Rail was opened, groundbreaking, a lot of criticism of it, also a lot of support. 1983, the Māori staff at the Tokanui Hospital opened Whaiora, which was the first Māori, kaupapa Māori health unit within a hospital. 1993, the Māori nurses formed the Kaunihironga Nehi Māori, still in existence. They had come together as a group. And in 1994, there was a big hui here, the Hui Taumata, which looked at the Māori economy. And in that same year, the Māori Women's Welfare League published Rapawater, which was a book and contained their findings from a research project they had done on the health of Māori women. It was done by the League themselves. All the interviews were done by League members. Average age about 65, 66. These were women who had not had any experience of researching, would knock on a door. Is there a Māori woman in this house? If they said yes, then they went in and interviewed that woman. They had a 92% acceptance. That's because when they knocked on the door, they also put their foot in the door to make sure that they got in. They had their own way of interviewing too, some of these women. One of the questions was, what is your religion? I think if you put that in a questionnaire now, not many people would understand what you mean, but in those days, it was a very important issue. And in the feedback that I heard from one of the ladies who had done the interviewing, she said, this woman said to her, I'm an atheist, I don't have a religion. And so the interviewer got up and said, my dear, your grandmother was an Anglican, your mother's an Anglican, so you're an Anglican. And she ticked the Anglican box. So some of the quality of the research sometimes came under criticism, But the findings of the research were incredibly important, and it represented a whole new approach to research and a much better understanding of the wider capacities of health of women, but of Māori generally. 1984, the whānau Waipareira was formally operated as a trust, and in 1985 the first kura kaupapa Māori opened at the Hone Waititi Marae. 1987 the Māori Language Act was passed, and in 1988 Te Pūao Te Atatu and Matua Whāngai were produced as really important documents. Matua Whāngai was an answer to Oranga Tamariki. The idea was that there would be no children in placement, they would be placed with whānau. It worked for a time and then was taken back to the more conventional approach that operated. So in that decade, 1980 to 1989, some amazing changes. The other thing that happened, and John already referred to this morning, was the Hui Whakaoranga in 1984, held at the Hone Waititi Marae in Auckland. Had been organised through the Department of Health, and Lorna Dial and Paratene Ngata had a large role in putting it all together, attended by a whole range of people, some involved in the health services, some involved in iwi development, some involved in the New Zealand Māori Council, a whole range of people who are not just involved directly in health. And we had some great speakers there. There were these five, particularly that Dame Whina Cooper came on to the marae waving a karamu branch, and throughout the hui, she said, "This is the answer." She had convinced that karamu, and what she was saying, of course, was the wider environment is a really important part of health. And she stayed with the hui right through. She was a bit older then. Raiha Mahuta gave an address, and she talked about Haurora, Raukawa, or Tainui, Raukawa, Haurora, or Tainui, and that was the first Māori KMO, the first Māori health organisation. It had opened in 1983, and Raiha was involved in its opening. People were in disbelief and thought that that'll never work, that you've got to be linked more closely to a medical situation to run a health service. Raiha was showing that it doesn't have to be that way, and that was a foundational movement. As I mentioned, the Māori Nursing Council had been established the year before. They were in force at this hui, presented themselves, illustrated their own organisation, how they had organised it, and that was a trailblazer. Willie Carr, who was in education at that point, gave a really inspiring address where he talked about the significance of education for health, that was a fundamental on it. And then Eru Pomare talked a bit about his work he'd been doing on Māori and non-Māori health disparities. So that was happening at this hui in 1984. And then I was on a panel with three others. Rose Perry was one of the panel members, and she talked about Te Wheke, a model for health. I talked about Whare Tapa Whā, which had only been around for a couple of years. And then Sonny Waru from Taranaki talked about a program he had established for glue sniffers. I don't think they have them now, but back in those days, glue sniffers used to be in the streets of Auckland, and he would take them back up to 10 at a time, and they would do a 6-week tour of the marae in Taranaki, staying on each one for a period of a week or 10 days. At no stage did he talk about glue sniffing or being bad. He just gave them this strong feeling that they were part of a wider environment. And again, that's lack for funding, but what he was showing was that promoting the helping people reach their potential and helping people focus on something positive is probably as important as addressing the problem. And then Nitama Paiwai, Dr. Paiwai, who's a general practitioner at Kaitai or Kauwhata? Kaikoi, was it? Yeah. He was a general practitioner there. His family are here today, some of them. And he talked about how, in addition to his work as a general practitioner, at nights he used to hold wānanga or learning sessions for some of his whānau who were not very good at organising themselves financially. So he'd have financial learning and economic planning for these whānau. So they were some of the events that began to unfold at the Hui Whakaoranga. There's one other really important event that happened, and that was through Whatarangi Wuniata, who was at the Hui, and he got up and made a speech addressing the health department people who were there, and finished up his speech by saying, "Give us the money and we'll do the job." That was his, and of course that's been a cry ever since. Give us the money and we'll do the job. Decade 3, 1990 to 1999. 1990, the Māori Congress was formed, officially formed. It started the year before. Hebi Tioho, Tiata, and a Ratana leader, they sponsored it. It really was an opportunity for iwi to get together without being funded by government. It was an iwi one. Every iwi put in a certain amount. I think it was $5,000. Ngāti Kauwhata had always said, well, we are actually quite different from Ngāti Raukawa, until we heard that it was $5,000 and we said, actually, we're part of Raukawa through a different line. So there was a bit of innovation going on at that hui, but they were quite powerful hui where iwi leaders were talking. It came to an end in 1995. One of the reasons, to me it was the main reason, was that there was a vote about sea lords. Some of you may remember the sea lords debate that went on. Is this a good deal we should accept? It was a proposal for Māori fishing. Or should we look at another proposal? And it was pretty clear that the Congress leaders were fairly divided on it. And when they took the vote and the deal was approved, things began to fall apart. And yet the main theme for the hui had been kotahitanga. Looking back on it, I was secretary, missed an opportunity. Really, what we should have done was not have a vote. If the value you put most high is kotahitanga, and you're going to vote on something that will divide you, you're going against your own values. Don't vote. What we should have done, if we were going to vote, was to have a vote to say that we recognise the independence of every iwi to make their own decisions on matters in their own rohe. And really then, but focused is more on the kotahitanga than on voting. So sometimes this vote of the majority rules is not actually a very fair or a very wise vote to have. 1993, the Electoral Reform Act was passed, which clarified the position of Māori voters. 1995, the first treaty settlements, Tainui and Ngaitahu, both of them signed off. I think there was 185 each for there, and they became kind of the standard for the settlement process which was to follow. And 1995, the Pākaitori protest at Whanganui, where iwi from Whanganui occupied the land known as Pākaitori. That decade also saw the expansion of Māori health organisations. From 1993, and that's when there was a health reform, and the health reform separated the funders of health services from the providers of health services. that enabled Māori organisations to apply for funding to the funder, not to a health service. Today, that disappeared when the split between funder and provider came to an end, and so DHBs became the main funders and the main providers. So I think you call that a conflict of interest, but what gave birth to so many Māori organisations in those early years in the 1990s was it became possible to apply for funding from an independent funder rather than from a competitor. And so the number of KMOs, kaupapa Māori organisations, has blossomed ever since then, but it started, of course, with the one in Tainui that I've spoken about already. In that same time, the Māori health workforce began to expand. It had been slow, but then the number of doctors involved began to increase, and in 1995 they formed themselves into an organisation called Te Ora. Te Ora. Te ao marama, my psychologist, I think, no. Dentists, right? Dentists and associated dental workers formed Te ao marama, ngā pūmanawa hauora, research centres that were jointly funded, and so we begin to see in the 1990s a more definite entry into the workforce of Māori providers. But in that 1994 was also another hui, the Te Ara Ahu Whakamua, the Māori Health Decade hui, 10 years after the hui Whakaoranga, and they wanted to see a much stronger case for having accessible, better resourced and accountable to Māori organisations. They placed emphasis on whānau, but also on iwi, on wānanga and health clinics within the community. And they said at that particular hui that there was support for the establishment of a Māori health authority. So here we are some years later, still trying to implement that. Decade 4, 2000 to 2009, He Whakaoranga, the Māori Health Strategy, was emerged in 2002. Te Rau Matatini, which became Te Rau Ora in 2002 also. There was the foreshore and seabed procession, which was really demanding Māori ownership of the foreshore and seabed rather than what had been proposed. And in 2005, the first Iwi Chairs Forum was held at the Takahanga Marae. 2006, Tuheitia became the sixth Māori king. And in 2007, Hauora Māori Standards of Health, the fourth edition, appeared, as did a framework for Māori health and addiction in 2008. And in 2009, there was a very significant Māori housing forum held. Two other big events in that decade. One was the Hui Taumata Mātauranga from 2001, started in 2001 and went through to 2004, a series of 5 hui that were held. Tumu Tioho was the organiser of it, and some of the things that emerged there that were relevant to health as much as education, that the aim should be that our young people, should be able to live as Māori, as citizens of the world, and should be able to enjoy good health and a high standard of living. So that was an aspirational goal that came out of that. And the second one was the recognition that whānau are gateways to education, health, economy, society, and Māori potential. And in 2005, Te Puni Kōkiri's Māori Potential Framework emerged based around 3 pillars: whakamana, mātauranga, and rawa. So into decade 5, some of you will be getting closer to remembering these. The 2011, a really groundbreaking report, Whakaoranga tēnei, which is Y262, and it was about environmental protection, recognising that unless we take steps to recognise it, and unless mātauranga can be applied to environmental science, then we won't be making much progress. Also recognising that the environment was a key to health. Then in 2011, Te Matapihi Housing, hui was held, again an important step of Māori taking a stronger interest in promoting their own approach to housing. 2016, Ihu Mātau was occupied for the first time. I'm not sure whether it's been resolved or not, but I've heard a rumour that it might have been resolved, but I don't think it's been officially announced. 2017, Whanganui River became a legal entity, which was a major step in looking at it. 2018, there was protests against seabed mining in Taranaki, and in 2019, there was the Whakaari eruption. I think Pānea Newton stands out in that decade as a young leader who was moving her people, and all of us really, into a stronger position. So the other thing in Decade 5 was we begin to see that there is a shift in the system. And Tariana Durie put through in Parliament the program now known as Whanaora. The difference between Whanaora and other programs, that Whanaora was a combination of health, housing, social welfare, education, as opposed to what we've been accustomed to, where you split all those things into separate piles. So a really significant development, followed in 2014 by the Whanaora commissioning agencies, a new way of funding, so that the accountability for Whanaora programs goes to the Whanaora commissioning agencies, who don't respond, they're not accountable to a department of the government, they're accountable to the Minister of Whanaora. So it's a different level of responsibility, and it's one step away from state control. 2014, Paiora, which we'll hear about, Mauriora, individual health, Whanaora, health of whānau, and Waiora, the health of the environment, seen as three main pinnacles for Māori health into the future, now incorporated into the strategy. And in 2019, Y275 was released with recommendations about health services and outcomes for health. So this was this decade just passed. You can see there are changes in the system that were beginning to emerge. So here we are in Decade 6, 2020, Whakamaua, the Māori Health Action Plan is released with the focus, shifting the focus of health away from health services entirely to having a much wider view of health and what it means and what action might mean. 2020, the COVID Māori response has been phenomenal, really. Every other pandemic we've had in this country, going way back to the 1800s and then into the flu epidemic of 1918, the smallpox epidemic, Māori death rates were 3 times higher than non-Māori rates, and Māori number of Māori who got illness was 5 times higher. In the COVID response, the Māori number of Māori people who have caught COVID is only 7% of the total who have COVID. That was unexpected. The expectation was that Māori would be severely affected by it. The reason they weren't affected was that Māori took it into their own hands to protect their people. So that one of the first public views of that was that some of you might have been there, roadblocks, people saying you're not coming in here because we want to protect our whānau. So they were very protective, trying to keep their own people safe and isolated. Marae said if we're going to be helpful, we want to shut down the marae. Our marae shut down on March the 19th, which was actually before the lockdown. Partly because some debate about it. Some people said, well, if you might want to use the marae as a place for people to have refuge. The other view was that we can't guarantee the safety of our people. What we should do is lock it down. So we locked that down. Whānau support began to roll around right through the country. Whānau water packages were delivered, particularly to older people. And we saw that a number of our own people began to take on new roles, such as vaccination for other things, and also testing for COVID. 2021, there's an announcement that a Maori Health Authority will be established. It's ongoing, it's not, it's just getting off the ground. The talk about it is just getting off. 2021, Oranga Tamariki began to talk about a Maori Transition Authority. So we're going to be well, we'll have a lot of authorities, better watch out in this year. In 2021, 1 week ago from today, there's a group of unruly people walk through the streets of Fielding. And if you see that man at the front leading the haka, you're going to hear him talk tomorrow. But that was a protest against excluding Maori wards when council have the opportunity to incorporate Maori wards into their routine. So that's just a hint of what this decade might bring. It's been quite a powerful start to a decade. We might see how that proceeds. But really what I want to talk about is the decades ahead and what will give shape to them. How will they be shaped? We can learn a lot from the past that we've already seen. But we know that the future will be different. Our population will be close to 1 million. It's now getting towards 800,000. If you add to that all the people in Australia who are working in the mines and other things, the population will be over 1 million. Our people will live longer. Maori life expectancy for men and women is increasing, and the rate of increase of life expectancy for Maori is greater than the rate of increase for non-Maori. That's because when you get sort of above 90, you slow down the rate of increase. But our life expectancy is getting longer, so in the future we can expect to have more older people. We know that whānau will be dispersed across Aotearoa and the globe. They won't be living in one place, they'll be all around the world. We know that we'll have digital communication as part and parcel of life, and that our tangi might be Zoomed, our births, 21st birthdays, weddings, we might attend them digitally. We know that our water, our land, our air are going to be exposed to multiple threats that we haven't even contemplated. We're beginning to see them now. Global warming and an overpopulated world can spell disaster. We're going to have more pandemics. COVID was just a test. There's going to be more pandemics and other catastrophes. We're going to have to shift the focus from late intervention to early intervention and prevention. We can do much better there. There'll be new technologies that'll affect the way we work, the way we learn, and the healing that we do. And marae will feel the dual pressure of encroachment and cultural diffusion. On the positive side, we'll have many more well-qualified Māori to cope with the changing world. Just talking about the medical profession, for example, there's now something like 400, close to half, 400 or 500 Māori doctors. Unthinkable 3 or 4 generations ago. We'll see our rangatahi grow into confident leaders, and we've seen some of that already today. As we saw during COVID-19 pandemic, we will continue our proud tradition of responding to change in a decisive way. We won't be told to do it, we will want to do it. And we'll build on the foundations that we've already laid over the last 50 years so that we can be well prepared for future challenges. These are the foundations that we can pick up for the last 50 years. Whenua, land, it's a foundation for health. Te taio, our environment, a major foundation for health. Whānau and whanaungatanga, mātauranga, Raukawa, our capability, our workforce. Te hononga, the way we collaborate rather than stay in silos. Hautūtanga, our leadership. Te ao whānui, looking at the global perspective. Te Tiriti Waitangi and its relevance to the future. And rangatiratanga, self-determination. I'm just going to talk about those 10 things because they are the foundations that we can pick up from those 5 decades I talked about, foundations that are going to be relevant to being healthy in the future. So the first one then is whenua. What would we be called tangata whenua if we had no whenua? We've got a bit of a problem there. Land is more than an asset. Land grounds us, land leads us, land feeds us, land connects us, land is the foundation for our homes, and land defines us. The task in the future will be to protect the land, and in so doing, Māori will be able to live well as tangata whenua. So land is critical for health. And a task for the future is how we can protect our land. That's what Dame Whenua was doing in her time, the 1970s, was not 1 acre more, not just having land mass, but having land that is safe and secure and contributes to us. The other foundation is te taio, the wider environment. We've got to stop destroying land, stop waterways and forests in the air. We've got to stop Kiwi Rail for putting great big hubs on rural land. Perhaps we should have kaitiaki appointed to protect the environment, and they would have the authority themselves to oppose environmental ventures, including those in built environments, anything that's a threat to Māori health and well-being. And when I'm talking about environment, we're talking not only about the natural environment, but also the built environments in which we live. The streets that we live on, the houses that we live in. Every time we assess someone's health, we should also be assessing the environment that they live in, because that's where the answer may more often lie. Third foundation is whānau. Critical. Whānau are at the beginning, birth, and at the end, death. Whānau link us to the past and steer us towards the future. It's the intergenerational aspect of it. Whānau alleviate pain and generate hope. Whānau are the gateways to marae, te reo, and to te ao Māori. Whānau autonomy will be a starting point for rangatiratanga and will be reflected in the ways whānau assume leadership roles in a changing society. So that's putting a lot on whānau, but that's really the basis for change. Increasingly, whānau health will reflect ready access to housing, health, education and social services, but perhaps more importantly, it should reflect whānau autonomy and a whānau commitment to live well. The fourth foundation, He Kiti Mātauranga, is about Mātauranga Māori. Māori models for health and well-being, we've seen these develop over the last 3 or 4 decades. Te reo Māori and kaupapa Māori health initiatives will enable Māori to be Māori even when circumstances change. And the fifth one, Raukawa, is about having a workforce that has the capacity and the capability to make a difference. We want our workforce to be part of the community, not isolated from the community, to be well versed in te ao Māori, and to span the whole health domain so that it includes professionals, support workers, people with lived experience, all part of the leadership for health. And the sixth one, te hononga, recognises that splitting things into sectors or into disciplines really goes right against the world that we actually live in. We need a holistic approach that brings together health, education, housing, employment, welfare, and the economy in order to align with the realities where Māori live. We've got to get better at doing that a health program by itself will not necessarily generate the best health that we could have. We've got to have some way of pulling them together. And collective action, we need to have action that goes across disciplines and across sectors, so that will endorse Māori worldviews and strengthening resolve. This is something that is really needed, difficult to do in Wellington, but it may not be so difficult to do in our community. The seventh one, Te Toa Takitini, is about leadership. We want leadership that's collective and distributed. We don't want it all in one place. We want it to be distributed and working together. Our leadership will be evident in communities, hospitals, and in all health professions. It'll be supported by iwi. It'll be evident on marae. Our leadership will recognise Māori community priorities, not our own priorities, but the communities of our people, and will ensure access to quality care. And our leaders in health will be part of a wider Māori leadership team to take us into the future. The wider leadership team will be people who have got skills in other areas, but the collective nature of that will be important for the future. And Foundation 8, Te Ao Whānui, is about the world that we live in. Māori will be global citizens. Increasingly that's the case, and it's likely to continue. We should still be able to be Māori, even when living in other countries. And that's a challenge, but with digital communication and other things, that should be possible. But we also want to be part of a global Indigenous network. We want to be represented on international forums, Indigenous governance, worldwide health forums, sporting, academic initiatives, and trade and economic ventures, so that our future really means us making greater contact with the globe and the world outside us. And Foundation 9, Te Treaty o Waitangi, the treaty will continue to be part of all environmental, social and economic legislation and policies. Up until 1984, the treaty was seldom mentioned in education or in health or in those other social policies. Māori will experience genuine partnership and full participation in all aspects of society, and the Māori Health Authority will join other authorities to gain consistency and impact across health, education, housing, employment and social wellbeing. In other words, the Māori Health Authority will be part of a network of groups rather than standing alone as the only contributor. And Foundation 10, Rangatiratanga, Māori decision making will be evident in communities, regions and nationally, and that'll make it possible to live as Māori. Predictably, there'll be many Māori authorities built on the foundations laid by marae, by iwi, by Māori commissioning agencies, by kaupapa Māori systems, and by Māori community agencies. And a Māori Health Authority will have a national role. So there are already authorities around. The danger will be to isolate them into little bits. Māori authorities will not necessarily mimic state systems. So we wouldn't want, for example, the Māori Health Authority to mimic the wider health service. Nor will they be fragmented by sectoral approaches. Instead, they will adopt kaupapa Māori values to ensure that Māori can flourish into the future. So that's the 10 foundations that we pick up from the last 50 years, the last 5 decades, that will have some importance for health into the future. The land, the environment, our whānau, mātauranga, our leadership, a comprehensive capability, and this integration, which would be the hard bit, I think, to do, but also being part of the globe, recognise the significance of the treaty, and having self-determination. Haven't finished yet. So this is a question. Should we be ready to respond to a changing world? We know the world's changing. Should we be ready to respond to that? Or should we create the future we want? So do we wait to say things are changing, we'd better change? Or do we say we want to be ourselves, we want to be well into the future? What is it that we want? How are we going to do it? So the future we want, let's build on the foundations that have been laid over the past 5 decades, and then let's have some focused planning for the future. And I understand that's what's likely to happen at this hui later today and tomorrow. Integrated planning for the future, building on our foundations. When we do the plans, we then have to put them into action so that we can actually create our future, and that we hope will lead us to Māori ora. So thank you for the opportunity to be here. My apologies, I'm going to have to leave at 1 o'clock. But really just to reiterate that there is no future without a past, and that we should build on what we've got. The good news is we're not starting from scratch. If we had been having this meeting in 1970, we would have been unsure exactly where we want to go. We're clearer now what this decade is going to look like and the next one behind it. But we need to be thinking about what is it that we want as we move into the future, rather than how is the future going to dictate change to us. And then finally, in case you've forgotten, these are the foundations that will shape our health in the future. Whenua grounds us, Te Taiao protects us, whānau nurture us, Mātauranga defines us, Raukawa helps us, Te Hononga unites us, Hautūtanga guides us, Te Ao Whānui extends us, Te Treaty guarantees us, and Rangatiratanga asserts us. Kia ora.